Hello everyone, my name is Danny Clement, and I'm here to talk to you about the upper limb and its articulations, its joints, the bones. Um, First, we're going to talk about the shoulder because it's most proximal to the body, and I'm here to tell you that it's composed of the clavicle, the scapula, and the humerus. The humerus being the long bone we know right here, scapula being right here, and the shoulder blade known as in anatomy as the scapula. First, we're going to talk about the scapula, or as most people know it, the shoulder blade. This bone is actually very complex because it's an attachment point for many muscles of the body. These muscles allow us to have movement and support from and to the rest of the body. Allow us to have extension and flexion of the shoulder and also rotation. The scapula has a fossa, which combined with the head of the humerus creates the glenohumeral joint, right? Right here. This joint right here. The clavicle is the collarbone, as most people know it. It's in the anterior part of the chest and just superior to the rib cage. It's also part of the connection here of the joint. It's S-shaped, which it has a lot of connecting points for the rest of the muscles of the body, especially the chest and the arm, which allows us to have stability. The clavicle meets at the scapula at the top of the shoulder, and it connects to the acromion process, forming the acromion clavicular joint. And now, finally, the humerus, which is the long bone we have right here. It's on the most proximal aspect of the arm, and it widens at the bottom here, having both medial and lateral epicondyles, which then later connect to the rest of the arm, of the limb, the upper extremity. This bone is important because it has the head, which when it's put in the socket allows us to have more movement than stability in the joint. What does that mean? In comparison to the pelvic girdle, the shoulder joint actually has more movement. It allows us to move more freely, which makes us more prone to injury. Next up, we have the ulna and the radius, which are the two bones of the distal part of the arm, right? The limb. The ulna being the bigger one, connecting to the humerus over here, creates what we know as the elbow joint. This is a hinge type of joint, which only allows us two types of movement. This movement is flexion and extension of the joint of the arm. Now, there is another joint here. Having mentioned the ulnar and humeral joint, it is worth noting that there is another joint. The second one is the humeroradial joint, which is between, obviously, the radius and the humerus, which allows us for flexion and extension, but is also involved in a more complex movement, which is the pronation and the supination of the hand is this movement. The third pivotal point is where the more distal aspect of the ulna and the radius connects with the metacarpals here, and that is with the hand and the metacarpals. Next, we're going to talk about the hand. The hand is a very complex set of bones because it has two rows of carpal bones which connect to the radius and the ulna here, allowing us to do every flexion, extension, rotation that this joint right here allows us to do. Then is the metacarpals, which each connect to the phalanges. There's three types of phalanges. There's the proximal, the intermediate, and the distal phalanges. And those phalanges are connected to here, what we call a knuckle, but that's called the metacarpal phalangeal joints, which we call it the MCP. And then between each phalange is what we call the IP joint, which are the interphalangeal joints. The only one in our body that has a ball and socket is our thumb, which allows us to do all sorts of movement. And that is that.